Okay, the next section is exercise 2, surface anatomy, and we're going to use our skeleton to work through our landmarks. So I would suggest that you get your skeleton from your lab kit and work through these with me, and then there's sort of a quiz component in the lab manual, and that's part of what I'm going to be putting on your lab quiz for this week. So surface anatomy landmarks can help us identify regions on the body, and again, we think about anterior, the front of the human body, and posterior because we're bipedal, walking upright. Anterior and posterior on a human are a little bit different than anterior and posterior on a dog, let's say. So some terms that we would associate with each of the anterior and posterior positions. We'll begin with anterior, and some you've probably heard of and some might be new. And I recommend that you don't be afraid to try scientific terms. One of the best tools that I found online is dictionary.com. So if you ever get a little nervous about the pronunciation, go to dictionary.com and there's a button that you can hit to actually speak it for you. But I'll try to walk you through these terms today. So we'll begin with abdominal. Abdominal, and of course in the skeleton there's not much to point to because there is no skeleton in the abdominal region. But basically this is everything below the diaphragm, which is a landmark membrane internally, and we'll be talking about that in a few chapters. Acromial is the point of the shoulder, acromial. The next term is antebrachial. Antebrachial is the region from the wrist to the elbow, and the region from the elbow to the shoulder is called brachial. Again, this becomes important when we think of the arteries and veins. We'll talk about the brachial artery, which will be running right over the elbow region. So antebrachial from the wrist to the elbow, brachial from the elbow to the shoulder. Axillary is the armpit region. Again, important when we think of things like lymph nodes in the axillary region. Inside the mouth, in the inner lining of the mouth, the cheek cells are called buccal cells, B-U-C-C-A-L. Returning to the arm for a minute, the region that we call the wrist is more accurately defined as the carpal region, carpal, C-A-R-P-A-L. The cephalic would be the head region, anything pertaining to the head region. We might hear about cephalization. That's a term we use with evolution and sort of a movement towards cephalization. The cervical region would be the neck region. We talk about the cervical lymph nodes along the jawline, but again, we use cervical in reference to the neck. We talk about the cervical vertebrae later on. Coxal, C-O-X-A-L, is the hip region. Coxal would be the hip. Crural, C-R-U-R-A-L. Crural is the front of the lower leg, so the knee to the ankle. Crural region. This one, the patella is a little bit loose, so we have to ignore that. But crural region. Digital. Digital, I'm sure you're thinking of digital imaging and that sort of thing, but in the case of human anatomy, digital means anything relating to the fingers and or the toes. So collectively the bones are called the phalanges, but we talk about all of these as the digits or digital regions. Femoral. Femoral region is the thigh region. This particular bone is the longest and strongest in the body, the femur, and that's where the name femoral comes from. Fibular, F-I-B-U-L-A-R. The fibula is this smaller bone from the knee to the ankle, and so this is the fibular region, again, kind of on the lateral side, so away from the midline. Moving kind of back up the body to the skull for a moment, the frontal region. This skeleton doesn't show it very clearly, but there's a bone right here called the frontal bone, and this whole region is called the frontal section. We have a muscle called the frontalis muscle that helps us raise our eyebrows, and so forehead would be another way to think of that. I don't think we need to pan down to it, but the big toe region is sometimes called the hallux region, H-A-L-L-U-X. The next column, if you're following along on your table, the inguinal region would be anywhere in the groin. So again, inguinal lymph nodes we discuss later on in the immune system. Not shown on the skeleton because this would be tissue sort of on the skeleton or on the framework of the skeleton. The mammary region, we are mammals. One of the key features of mammals is the presence of mammary glands or breasts. and those are present in both males and females, but we associate more development with females. The chin region is sometimes called the mental region, M-E-N-T-A-L. Nasal region, the nose, that one's probably familiar to you, and oral region, the mouth. Around the eyes, we call this the orbital region. On the palm of the hand, we sometimes describe this as the palmar, P-A-L-M-A-R region. A few minutes ago I mentioned the patella, this tiny little bone that helps to sort of keep all the muscles, ligaments, and tendons and things together. And the patella, or patellar region, would be here. We sometimes call that the kneecap region. The foot, again, I think you're familiar with this, but the pedal, P-E-D-A-L, you might also pronounce that as pedal of your bike. Again, both pronunciations are appropriate. The pelvis, and we would think of the coxal bones or the hip bones, the pelvic region. One of the things that we'll notice later on with the skeleton is that female and male skeletons can actually be distinguished because of the size and arrangement of those two pelvic bones. Females tend to have a more shallow and wider pelvic opening to allow childbirth. The pollex, the thumb region, P-O-L-L-E-X, another anatomical landmark. The pubis or pubic region, the genital region, again, this would be part of the material tissues that would be on top of the framework of the skeleton. The sternal region, the sternum is this bone right here that kind of looks like a dagger. This is sort of the handle or manubrium region. We don't need to know that yet, but later on we'll talk about the three regions of the sternum. But we do talk about the sternum region of the body. The sternum is helping the ribs attach and protect the lungs, as well as the heart and some of those other thoracic organs. So thoracic is actually one of the next terms. The thoracic is the chest region from the diaphragm up, and everything below the diaphragm we said was abdominal. We'll talk about that when we get to the cavities of the body. The tarsal region, I'll just mention the tarsal region, that's the ankle region. So remember that the wrist was the carpal region, and the tarsal region, we talk about the ankle. Some of those bones are fused together and collectively called the tarsals. And then the last landmark, according to this worksheet, is the umbilical region, which again, we can't really distinguish, but I'm sure you're familiar with your umbilical cord, the navel region of the human body. And these are all anatomical landmarks associated with the